Let's sit at the round table and discuss. 1 in 8 women will be diagnosed with breast cancer in their lifetime. That is 1 in 8 women. I'm here to bring awareness to breast cancer. Since it's Breast Cancer Awareness Month, I want to honor every single woman that is currently going through breast cancer treatment, chemotherapy, and for all of those who we have lost due to breast cancer. Unfortunately, I want to honor you and everyone you care about. I came across this site, the Project Renewal. The Project Renewal came up with the country's first scan van, a mobile truck where you can get your mammogram, your radiology exams, such as your tuberculosis, and especially your mammograms. Everyone is welcome to get their mammograms done. Whether or not you have insurance, your legal status doesn't matter. If you're homeless, you're very welcome to come to these vans. You can go on this website, the projectrenewal.org/scanvan, to make an appointment or find their locations. In 1 year, the scan van has screened 4,479 low income women for breast cancer, regardless of insurance or legal status. And they detected breast cancer in 12 patients and ensure follow up care for every single one of them, which is crucial. 12 patients. I'm so glad they were able to get assistance through the van. Now, I want you to listen to a quick video or anecdote of women who experienced breast cancer and what happened as a result. We provide healthcare for homeless and low-income men and women, regardless of ability to pay insurance or legal status. Scan van or mobile radiology.
I have a history of breast cancer in my family. My grandmother had breast cancer, and I had an aunt pass away from it. And I just had an aunt have a double mastectomy. And so it's just something that runs kind of rampant in my family. So it's important for me to make sure that I stay in the healthy zone.
Yes, it's very, very important that you ask your family for their medical history because you can be affected by this and not know it because you don't know your family history. So get to work, ask your mom, your grandmother, your grandparents what medical conditions ran in their family, especially breast cancer. Okay, let's get back into the video.
My son was around 2.5 years old, and I had just stopped breastfeeding because it started to get a little painful. He got teeth, and I had a pain on my breast, my left breast, but I didn't really pay any attention to it. One day I just said, you know what? I better try to get this free mammogram because I didn't have health insurance. And I'm glad that I did that because if I hadn't done it, I would have never found out that the lump that I had was not a buildup of milk, but it was actually breast cancer.
Listen to this very carefully. I want to stress the importance of us checking our breasts once in a while, at least once a month, for any lumps, any abnormalities, especially in the armpit area and the area surrounding the breast and the nipples. Any inverted nipples, those could be signs of abnormalities within the breast. Um, Although there are women who naturally have inverted nipples, so that's considered normal. But if you are not one of those, then it's worth checking it out with your doctor. Let's get back into the video.
It just breaks my heart sometimes when I see people with that disease or who are struggling because I didn't know what a person would have to go through. At first, I totally felt horrible because all I could think of was who's going to take care of David? Who's going to take care of Lloyd? What are they going to do?
And these are concerns that women who are also mothers have when they become diagnosed with any conditions, particularly breast cancer in this case. Who is going to care for your loved ones, your husbands, your children, and anyone else you care for? That's a legitimate concern. So it's worth thinking about having a plan in case that something like this happens to you or anyone you care about.
Thank you, David.
Thank you for my mom.
I am so thankful for life. There is no such thing as a bad day because every day that you have breath in your lungs, it's a good day.
Thank you. Such a beautiful story. I'm glad she was able to come out of that. Cancer is a monster. I tell you, I don't know what other term to use to refer to it. And I'm grateful for those who have been able to recover. And it's very unfortunate for those who don't make it. But we'll continue to keep fighting. Remember, if you can go on the website, the projectrenewal.org/scanvan and book your appointment. You don't need insurance or proof of legal status to become eligible to have a mammogram. Okay, and this was Lena, your host from the Lena Roundtable. Please, let's continue to have conversations that affect me, you, and everyone you care about. Until next time, bye.